Imagine feeling a strange pressure in your chest tonight. You are not doubled over in agony. You can still talk. You can still walk. So you tell yourself, it's probably indigestion. That sentence could become the most dangerous decision you make. A heart attack does not always announce itself dramatically. Sometimes the most important warning is simply that something feels wrong. Now imagine a 68-year-old man named Robert sitting at his kitchen table after dinner. He feels unusually tired, slightly sweaty, and notices pressure across his upper chest. Nothing is unbearable. He thinks about calling his daughter, but then thinks, I'll give it another 20 minutes. That 20 minutes becomes the decision he wishes he could take back. I'm going to walk you through 5 actions that can change what happens between the first warning sign and professional treatment. These are not miracle tricks, and they are not a replacement for emergency care. They are practical decisions designed to help you avoid the mistakes people make when fear, denial, and confusion take over. First, understand something that could save you from dismissing the warning. A heart attack is usually caused by reduced or blocked blood flow to part of the heart muscle. That means the heart is not receiving the oxygen it needs. The longer that problem continues, the greater the potential for permanent damage. That is why rapid treatment matters. And here is the reassuring part. You do not need to diagnose the exact artery, identify the exact type of heart attack, or know what your ECG would show. Your job is much simpler. Recognize a concerning pattern and activate professional help. You are allowed to be uncertain. You are not allowed to let uncertainty become an excuse for dangerous delay. A dangerous habit is waiting for pain to become dramatic enough to count. Instead, pay attention to pressure, squeezing, fullness, heaviness, or discomfort in the center of the chest. It can also appear in the arm, shoulder, back, neck, jaw, or upper stomach. Shortness of breath, nausea, sweating, unusual weakness, or lightheadedness can accompany it. Why does this matter? Because your brain loves familiar explanations. You ate a heavy meal, so you blame dinner. You lifted something yesterday, so you blame a muscle. You slept badly, so you blame exhaustion. But if discomfort is unusual, persistent, recurring, or accompanied by other warning signs, do not try to win an argument with your own body. Women can also experience symptoms that are less stereotypical, including shortness of breath, nausea, unusual tiredness, weakness, or discomfort in the back, shoulder, or arm. So can men. The safer alternative to guessing is evaluation. If symptoms suggest a heart attack, call your local emergency number rather than waiting for a perfect textbook symptom combination. This sounds obvious, but people still think, the hospital is only 15 minutes away. I'll just drive. That decision can create a second emergency. A heart attack can suddenly cause dangerous rhythm problems, fainting, or cardiac arrest. If that happens while someone is driving, there may be nobody equipped to respond immediately. The safer strategy is emergency medical services. When you call, the response can begin before you reach the hospital. EMS professionals can assess you, begin appropriate emergency care, and coordinate with the hospital. In some systems, information such as an ECG can be transmitted ahead so the receiving team can prepare. That is very different from arriving alone and starting the process at the front door. Picture Robert again. His wife says, "Let's just get in the car." But instead, they call emergency services. Robert stays where he is while trained professionals come to him. The hidden benefit is not merely transportation. It is bringing trained medical help into the dangerous period when his condition could change unexpectedly. Here is a technique almost nobody talks about. Prepare your surroundings. Once emergency help is coming, avoid unnecessary movement. Sit somewhere safe and accessible. If you are alone and physically able, make it easier for responders to reach you without putting yourself at risk. Follow the dispatcher's instructions and keep your phone available. Why does this matter? Because emergencies become chaotic when responders cannot quickly find the patient, when doors are locked, or when important information is scattered. A simple preparation step can remove another obstacle. Have your medication list available if you can do so safely. Tell the dispatcher where you are and follow their directions carefully. Imagine someone experiencing symptoms upstairs in a locked bedroom. The ambulance arrives, but the team cannot immediately reach the person. That is avoidable friction during an emergency. The safer alternative is not wandering around the house trying to organize everything. Do only what is safe and practical, then conserve your energy and wait for trained help. This is where internet advice can become dangerous. You may have heard that aspirin can help during certain heart attacks because it interferes with platelet activity. That is true, but the correct action is not to swallow aspirin first and then sit around waiting to see what happens. Emergency care comes first. The American Heart Association advises people with heart attack warning signs to call 911 immediately. After the call, the emergency dispatcher may recommend aspirin if appropriate and can check for reasons it may be unsafe. Aspirin is not appropriate for everyone, and taking it is never a substitute for emergency evaluation. So the hidden risk is self-treatment based on a social media rule. Someone may have an aspirin allergy, a bleeding problem, or another reason it is inappropriate. Another person may actually be experiencing something other than a heart attack. The safer approach is simple. Activate emergency care first and let the dispatcher or medical professional guide you about aspirin. This distinction could completely change what you do. During many heart attacks, the person is conscious and experiencing symptoms while blood flow to part of the heart is impaired. Cardiac arrest is different. The person suddenly becomes unresponsive and is not breathing normally, often only gasping. That is a CPR emergency. Why is this distinction so important? Because you cannot treat an unconscious person the same way you would treat someone who is awake and describing chest pressure. If someone suddenly collapses and does not respond normally, call emergency services immediately. Put the phone on speaker if possible and follow the dispatcher's instructions. If an adult suddenly collapses and is not breathing normally, begin hands-only CPR by pushing hard and fast in the center of the chest. Current AHA guidance recommends a compression rate of about 100 to 120 per minute and a depth of at least 2 inches for an average adult. If an AED is nearby, have someone retrieve it and follow its prompts. The hidden risk here is hesitation. People often think, what if I hurt them? But in a suspected cardiac arrest, doing nothing is the bigger danger. You do not need to become a perfect CPR instructor in that moment. Call for help, begin compressions, and follow emergency dispatcher instructions. An AED is designed to guide rescuers through its use. This may be the hardest situation of all. Your spouse looks pale and sweaty and says, "Don't make a big deal out of this." Your father feels pressure but insists he will lie down. Your friend says they are probably having reflux. This is where emotional courage matters. Do not shame them. Do not argue for 20 minutes. Encourage emergency evaluation. A calm sentence can be powerful. I hope we're wrong, but I would rather have a false alarm than ignore something serious. That removes the embarrassment factor. According to the AHA, even uncertainty should not be a reason to delay calling emergency services when heart attack warning signs are present. And here is another mistake worth remembering. Do not let symptom improvement automatically convince you everything is fine. Heart attack symptoms can come and go. Someone may feel better for a few minutes and then become worse again. The correct question is not, did it stop? It is, was this unusual enough that it needs urgent medical assessment? You can prepare before any emergency happens. Learn your local emergency number. Keep important medical information accessible. Know where your medications are listed. Make sure family members know how to recognize concerning symptoms. And consider learning hands-only CPR and becoming familiar with what an AED looks like and how it provides spoken instructions. Then ask your doctor a question many people never ask. If I develop chest pressure or other symptoms, what should I personally do? Your doctor knows your history, medications, allergies, and medical conditions. That conversation can remove uncertainty before an emergency occurs. Now let me return to Robert. His story could have ended very differently. But this time, instead of waiting for the pain to become dramatic, he listened to the unusual combination of pressure, sweating, and weakness. His wife called emergency services. They did not drive themselves. They followed instructions and waited for trained professionals. The outcome was not determined by a magic trick. It came from avoiding delay and getting the right system moving quickly. That is the real lesson. You cannot control every cause of a heart attack. You cannot control your genetics, your age, or every medical risk. But you can control whether you dismiss warning signs for another hour. So remember these 5 ideas. First, take unusual chest or upper body symptoms seriously. Second, call emergency services rather than driving yourself. Third, make your location and medical information accessible while you wait. Fourth, ask the emergency dispatcher about aspirin rather than guessing. Fifth, if someone becomes unresponsive and is not breathing normally, switch immediately into cardiac arrest mode. Call for help, start CPR, and use an AED if available. Here is the question I want you to answer in the comments. If you suddenly developed unexplained chest pressure tonight, would you know exactly who to call and what you would do next? If your answer is not completely, that is not something to be embarrassed about. It is simply something you can fix before you ever need the knowledge. Because the most dangerous moment is not necessarily when the ambulance arrives. It may be the moment before you decide whether your symptoms deserve attention. That tiny decision, I'll wait a little longer versus I'm going to get help, can change the entire chain of events that follows. And if this video helped you understand what to do, share it with someone you love, especially a parent, spouse, sibling, or friend who tends to say, "It's probably nothing." Subscribe for more straightforward senior health information, and comment below with one word. Ready if you now know the first thing you would do. One final reminder. This video is for education, not personal medical diagnosis or treatment. Heart attack symptoms require urgent professional assessment. If you or someone else may be having a heart attack, call your local emergency number immediately and follow the dispatcher's instructions. If someone is unresponsive and not breathing normally, treat it as a cardiac emergency and begin CPR according to emergency guidance.